Hello all, I am Fadila Shaib, speaking to you from WHO headquarters in Geneva and welcoming you to our global COVID-19 press conference today, Friday, 20 November. As you may know, this week is World Antimicrobial Awareness Week. In addition to COVID-19 issues, today's press briefing will have a special focus on the WHO, FAO, and OIE launch of the One Health Global Leaders Group on antimicrobial resistance. Let me first introduce you to the WHO experts who are present with us or remotely. Present in the room is the WHO Director General, Dr. Tedros, Dr. Mike Ryan, Executive Director, Health Emergencies, Dr. Maria von Kerkhove, Technical Lead for COVID-19, Dr. Hanan Belkhi, Assistant Director General, Antimicrobial Resistance, Dr. Janet Diaz, Team Lead, Clinical Care for COVID-19, Mr. Derek Walton, Legal Counsel. Joining us remotely is Dr. Mariangela Simao, Assistant Director General, Access to Medicines and Health Products, and Dr. Sumya Swaminathan, Chief Scientist. Also in the room is Dr. Hailisus Helaton. He is the Director for Global Coordination and Partnership, AMR Department. Now, without further ado, I would like to hand over to Dr. Tedros for his opening remarks and to introduce our distinguished guests. Dr. Tedros, you have the floor.
Thank you. Thank you, Fadila. Good morning, good afternoon, and good evening. More cases of COVID-19 have been reported in the past 4 weeks than in the first 6 months of the pandemic. Across Europe and North America, hospitals and ICU units are filling up or full. This week, there has been more good news from vaccine trials, which continues to give us hope of ending the pandemic. At the same time, we must continue to use the tools we have to interrupt the chains of transmission and save lives now. The COVID-19 pandemic is a stark reminder of the intimate relationship between humans, animals, and the planet we share. We cannot protect and promote human health without paying attention to the health of animals and the health of our environment. That's nowhere more true than in the case of antimicrobial resistance, one of the greatest health threats of our time. Antimicrobial resistance may not seem as urgent as a pandemic, but it is just as dangerous. It threatens to unwind a century of medical progress and leave us defenseless against infections that today can be treated easily. Although antibiotics are a key focus, antimicrobial resistance also includes resistance to medicines for HIV, malaria, neglected tropical diseases, and more. Wednesday marked the start of World Antimicrobial Awareness Week, an annual opportunity to raise awareness of antimicrobial resistance and encourage best practices among the general public, health workers, and policymakers to slow the development and spread of drug-resistant infections. The slogan for 2020 is Antimicrobials Handle with Care. For years, WHO has been working with the Food and Agriculture Organization of the United Nations and the World Organization for Animal Health to address antimicrobial resistance and other health issues that arise from the interaction between humans and animals with a One Health approach. Our 3 organizations, called the Tripartite, conduct regular surveys to monitor country progress on antimicrobial resistance. Our latest report, with data from 136 countries, shows that almost 90% of countries have national action plans for antimicrobial resistance, but only 20% have identified funding for implementation. To help address that gap, together we have established a trust fund to support low and middle-income countries to develop a truly One Health approach to addressing antimicrobial resistance. thanks to the governments of the Netherlands, Sweden, and the United Kingdom, to date we have raised $13 million, which will provide the first round of support to 11 countries. Just this week, we have launched the implementation in Indonesia. Additional funds will be required for the next round of investment. Today, the tripartite is launching a new report that examines the international instruments that govern the use of antimicrobials and identifies gaps in regulations for use of antimicrobials in human, animals, and plants. Together, our three organizations will work to address these gaps and generate more global coherence in the use of antimicrobials. One of the most important ways to do that is through increased political commitment at the highest levels of government. That's why today we're launching the One Health Global Leaders Group, which will bring together prominent leaders from government, the private sector, and civil society organizations to advocate for urgent action to combat the threat of antimicrobial resistance. The group will be co-chaired by Her Excellency Sheikh Hasina, Prime Minister of Bangladesh, and Her Excellency Mia Mottley, Prime Minister of Barbados. The group will bring together key stakeholders in agriculture, health, development, food and feed production, and other relevant areas to maintain urgency, public support, political momentum, and visibility of the antimicrobial resistance challenge. It's now my great honor to introduce the co-chair of the One Health Leaders Group, Her Excellency Sheikh Hasina, the Prime Minister of Bangladesh, to say a few words. Your Excellency, you have the floor. And thank you so much for your commitment and support.
Thank you very much. Bismillahirrahmanirrahim. Her Excellency Mia Mottley, Honorable Prime Minister of Barbados, Directors General of World Health Organization, WHO, Food and Agriculture Organization, FAO, and World Organization for Animal Health, OIE. Excellencies, ladies and gentlemen, Assalamu alaikum and good afternoon to you all. I am happy to join the launching event of One Health Global Leaders Group on Antimicrobial Resistance as a co-chair. I would like to thank the important tripartite partners, WHO, World Health Organization, FAO, Food and Agriculture Organization, and OIE, World Organization for Animal Health, for their initiative to establish this group for coordinated action and collective global governance to address the serious challenge of the antimicrobial resistance. As the co-chair of this initiative, I look forward to working with my esteemed co-chair and the global leaders to combat the challenges for the health of people, animal, and for safe food and crop production and risk for the whole environment. Ladies and gentlemen, there is no doubt that antimicrobial resistance has become a global public health challenge, both for humans and animals. Endangering food production is leading us towards catastrophic results. We are running out of available antibiotics and soon could face another global emergency far severe than the current COVID-19 pandemic. This menace has the potential of rolling back most of our medical and therapeutic successes achieved through scientific advancements over the ages. Unnecessary use of antibiotics, wrong doses, and overall poor infection prevention are causing this grave situation. Inspired by the WHO Global Action Plan in 2015, we, Bangladesh, formulated the National Action Plan for Antimicrobial Resistance Containment 2017 to 2022. In Bangladesh, this document and its associated roadmap speak about our government's policy, thrust, and commitment to address AMR. This is an important component of our efforts to ensure universal health for all in our country. Now we need worldwide coordinated actions to monitor the nature of infections, to implement required control measures, and to raise global awareness against widespread use of antibiotics. We should also ensure affordable access to new antibiotics by all. For this, I also call for increased internationally coordinated investment for more research for inventing a new generation of antibiotics. Excellencies, prevention is better than cure. So, I would call upon the global leaders to make this timely initiative successful by providing advocacy, technical and financial support for effective implementation of the recommendations of the Interagency Coordination Group on Antimicrobial Resistance to address the global antimicrobial resistant crisis. I hope this leaders group will be successful to mainstream this vital health issue in all our important discourses, contributing to the united global effort to fight the ominous development of antibiotic resistance. I thank you all.
Thank you so much, Your Excellency, Prime Minister Hasina. I would now like to introduce the other co-chair of the One Health Leaders Group, Her Excellency Mia Mottley, Prime Minister of Barbados. Your Excellency, thank you for your commitment and support, and you have the floor.
Thank you very much, Director General Dr. Tedros Ghebreyesus, Your Excellency Sheikh Hasina, Prime Minister of Bangladesh, Dr. Kyu Dong-yu, Director General of the FAO, Dr. Monique Eloi, Director General of the World Organization for Animal Health. My government is honored to be asked to co-chair the One Health Global Leaders Group on this important area at a time when antimicrobial resistance has been identified as one of the signal threats to development over the next century. For us, there are too many, from the climate crisis to the pandemic to this, and therefore we've determined that we must face it head on. Antibiotics and similar drugs such as antifungals, antivirals, and antimalarials together, called the antimicrobial agents, have been used, as you said, for a while and have threatened now, if we don't get this correct, to reverse a century of medical progress. The systematic misuse and overuse of these drugs in human medicine and food production have contributed to this rise in antimicrobial resistance, or the ability of a microorganism to stop an antimicrobial from working against it. In simple language, for us, this threatens the effective prevention and treatment of an ever-increasing range of infections and is reducing our ability and the ability of health systems to protect vulnerable patients at the very time when we are more conscious of the need to protect all human beings as a result of this pandemic. AMR also reduces our capability to protect the health of animals and therefore also threatens safe and sustainable agriculture. We have become so dependent on the availability as needed of effective antibiotics to cover surgery and childbirth, as well as animal husbandry and other food production, that with increasing antimicrobial resistance, we face threats of the return to unsafe childbirth, increased illness and death with surgical procedures, re-emerging diseases such as tuberculosis or threats to food security and food safety, as well as economic losses to countries, and I would like to suggest in our case in particular with the multiple existential threats that small states face, developmental regression. All countries will be affected by this. Addressing it requires the acceptance that there must be an intersectoral issue that needs action across all sectors, since it has resulted from activities within both human and animal health, as well as in plant production. And this approach, therefore, by the three organizations is heartening. It requires a commitment to continued action within and across countries at all stages of development, from the very developed to the developing countries. The formation of this group, therefore, for advocacy and advising on best practice is clearly an acknowledgement of these realities. The goal of this group is to ensure that attention is kept on this important subject so that progress is shared. I must confess that at a personal level, I first learned about it a couple years ago through a documentary. And it just proves that we need to be able to speak to our people through multiple different media and not just from a scientific or government policy perspective. It is the awareness among our populations that will also place pressure on the systems to ensure that sufficient funds are invested in this area of research so as to ensure that we really do not reverse a century of medical progress. Like many other countries in the world, Barbados completed a 5-year national action plan to combat antimicrobial resistance using the One Health principles which shared the goals and objectives of the Global Action Plan on the same issue. Since then, the Multi-Sectoral Steering Committee has been conducting a stepwise implementation of the plan, starting with the strengthening of infection prevention measures after a health facility audit and an antibiotic stewardship in the Lone Public Tertiary Care Hospital in Barbados. The focus on infection prevention has served us well for the preparation of ourselves as we fight off this pandemic. We are also part of a South-South collaboration with the government of Argentina, the Pan American Health Organization, and the Caribbean Public Health Agency, started last year in 2019 to strengthen laboratory diagnosis of antibiotic resistance. Our experiences with implementation have served to highlight that education alone is not sufficient to change practice. At country level, testing infrastructure and materials, as well as trained personnel, are needed to identify gaps in best practice. Other resources are necessary to allow alternative ways of doing business, all of which are dependent on financing and partnership. The Prime Minister of Bangladesh made the point that we need to ensure equitable access for all across the globe. And we are even more sensitive to this reality given what we are facing with the pandemic. I hope that the world will find both the political will and the financial resources to encourage a multi-sectoral and multi-dimensional approach such that we can conquer this problem by putting sufficient resources behind the research necessary for us to move to the next level. There is a view that we have not put sufficient resources to advance progress on combating antimicrobial resistance. It is a view that Barbados shares. We are therefore committed to doing whatever we can, along with whoever we can, to achieve success in this struggle. For at a very personal level, almost all of us know people who have been victims of this antimicrobial resistance and of hospital-aided infections. It is up to us to ensure that we not only leave this problem behind us in the third decade of the 21st century, but that we also commit to ensuring that the vulnerable among states and the vulnerable among our citizens are not left behind as we fight this most grave of battles. I thank you.
Thank you so much, Your Excellency, Prime Minister Motley. And I'm also very proud that my new granddaughter actually shares the same name with you, Mia. So I'm really proud, and thank you for your support and commitment. I'm also delighted to be joined today by my colleagues in the tripartite, Chu Dongyu, Director General of the Food and Agriculture Organization of the United Nations, and Dr. Monique Elliott, Director General of the World Organization for Animal Health. Mr. Chu, welcome, and you have the floor.
Thank you. Thank you, my brother, and Your Excellencies, Prime Minister of Bangladesh and Barbados, ladies and gentlemen. I'm so happy to see all of you are safe and well. Taking this opportunity, I would like to thank my brother, Dr. Tedros, for the great leadership in combating the COVID-19 pandemic. Today, we are here to announce the establishment of the Global Leaders Group on the Antimicrobial Resistance, AMR. It is an important milestone of the AMR global agenda and will play the key role in global governance. The Global Leaders Group will have a catalytic impact and demonstrating the strong leadership and advance the response on AMR, which will sustain the political momentum and build the public support and resources mobilization at the regional and national levels. FAO is committed to work together with the WHO and OIE in tackling the AMR through the One Health approach. A new FAO action plan on AMR for 2021 to 2025 will be launched next year. This will consolidate FAO position to contribute to international efforts to combat AMR and to provide further support to government, producers, traders, and other stakeholders in adopting measures to minimize the use of antimicrobials and contain AMR. AMR is everyone's business. We are now in the middle of World Antimicrobials Awareness Week. FAO's theme for this week is AMR is here now and united to strengthen food system and secure livelihoods. A series of events are planned this week to increase awareness and stakeholders' engagement. During the COVID-19 crisis, we must not forget that the AMR is a slow-motion pandemic with a significant long-term threat to the global public health and food security, which needs multi-stakeholders' engagement. If AMR is left unchecked, the next pandemic we face could be bacterial and much deadlier if the drugs needed to treat it do not work. AMR is here now, so we need to double our efforts and strengthen our partnership with all stakeholders, international organizations, private sector, and civil society, because only together can we achieve the one world, one health, and one planet we are living on. Thank you for your contribution and engagement and commitment. Over to you, Mr. Tedros.
Thank you, DG Chu. Thank you so much for your partnership and friendship. And now it's my honor to introduce the Director General of the World Organization for Animal Health, Dr. Monique Elliott. Monique, welcome, and you have the floor.
Thank you very much for your introduction, and thank you for giving me the floor. Excellency, ladies and gentlemen, good afternoon, good evening. As you know, while we are all experiencing the global crisis due to COVID-19, severely impacting our life and altering the livelihoods of million families, we also must remain vigilant to other looming global health threats, such as antimicrobial resistance. The good news, because we have a good news, is that we know how to tackle antimicrobial resistance to avoid this issue becoming the next global crisis. But we need to act together and act now. At the World Organization for Animal Health, we also strongly believe in the fundamental idea of the One Health concept, whereby the health of humans, animals, plants, and the environment are considered intrinsically linked, and where global health risks such as antimicrobial resistance need to be addressed through this lens from the outset. The tripartite, our three-way partnership between the FAO, the WHO, and OIE, and UNEP, which soon, has been collaborating for over a decade to combat this growing problem, committing resources and energy into targeted activities based on the One Health approach to prevent an AMR crisis to arise. Within the animal sector, for instance, the OIE continues to strengthen veterinary services governance through appropriate and updated legislation and regulations. And the tripartite international instruments publication to the WHO DG, as referred to a few minutes ago, is an additional tool for doing so. Excellencies, ladies and gentlemen, the tripartite is placed in a unique position to develop actions and strategy to solve the global issues of antimicrobial resistance. However, the newly created One Health Global Leaders Group will help us to accelerate our efforts forward. The today launching of this group is not a starting point, but an important additional new step to bring together the power from heads of state, public, civil society, foundations, academia, private sectors, of course, to reimagine governance and advocate for a common objective, namely the prudent and responsible use of antimicrobials. I would like to, therefore, warmly thank all the personalities who have accepted to be members, and in particular, the two co-chairs, Her Excellency Sheikh Hasina, Prime Minister of Bangladesh, and Her Excellency Mia Mottley, Prime Minister of Barbados, who are with us today and apparently already very much engaged. Thank you for that. The tripartite will thus benefit from the strength of the One Health Global Leaders Group to strategically elevate the AMR issues, ensuring sustainable political momentum and support. So thanks to this One Health multi-sector approach, and together we will reconnect all the dots, ensuring humans, animals, plants and environment are kept healthy and safe from AMR. Thank you very much for your attention.
Merci beaucoup, Dr. Elliott, and thank you so much for your partnership and friendship, and thank you also to all our guests and our leaders, Prime Minister Sheikh Hasina and Prime Minister Mottley, and my two colleagues. We look forward to working closely with all of you to protect the medicines that protect us. Thank you so much, and Fadila, back to you.
Thank you, Dr. Tedros. Just reminding journalists that we have a simultaneous interpretation in 6 UN official languages plus Portuguese and Hindi. I would like now to open the floor to questions from members of the media. I remind you that you will need to raise your hand under the raise your hand function in order to get in the queue and to ask questions and unmute yourself. Can I maybe make a suggestion to our friends from the media? If you can start raising your hand for question on AMR, because we have the opportunity to respond to your question from several experts and guests. So I would like really to take the first question about AMR, and then we will come to your question on COVID and other issues. I would like to invite the first journalist, Laurent Sierot from ATS, Swiss News Agency. Laurent, can you hear me?
I can, thank you, but actually it's not a question on AMR, so do you want me to wait?
Yes, Laurent, thank you. I will come back to you later on. A second journalist I have online is Carmen Paun from Politico. Carmen, can you hear me?
Yes, I can, Fadela. Thank you so much. My question is actually about AMR and coronavirus. I was wondering if all the cleaning that is happening now around the world of surfaces and, public transportation and all that kind of stuff, which I understand also uses, antimicrobial substances, is there any concern that that will contribute on the long term to a rise in antimicrobial resistance? Thank you.
Thank you, Carmen. I would like to invite Dr. Hanan Balkhi to take this question. Dr. Belkhi?
Yes, thank you very much. That's a very important question, and I think there's a big relevance to that question, since there is a small body of literature that has been emerging on resistance to certain, not just the alcohol hand rub, but some of the detergents like the quat ammoniums and whatnot. That data is not really robust or strong at the moment, and I think in order for us to avoid such emergence of resistance, again, we encourage the researchers and the scientists to continue to tackle this issue, but we need to focus on the basics of infection prevention and control in the healthcare settings so that we do not need to overwhelm the system with the usage of these entities. So we cannot compensate for overcrowdedness, lack of change or cleaning between patients with the overuse of these agents. I hope that addresses your question. Thank you.
Thank you, Dr. Belkhi. I would like now to invite journalists from the Observer Times of India, Ashwin, to ask the next question. Are you with us?
Thank you. Thank you.
Go ahead, please.
Hello. Yeah. Can you audible to me?
Yes, you can ask your question. We can hear you very well. Go ahead, please.
Thank you. Which are the steps paved by WHO in order to establish, maintain, and monitor a network of international basic science research centers that will support?
You were cut. Can you just...
Fundamental investigations into the...
Yeah.
Hello.
Hi. I think you were cut. Sir, is your question about COVID or antimicrobial resistance?
Is on a microbial threats to the global health.
Can you just repeat your question? You were cut in the middle, please.
Yeah, sure. Which are the steps paved by WHO in order to establish, maintain, and monitor a network of international basic science research centers that will support fundamental investigations into the pathophysiology of certain microbial threats to the global health?
Okay. Thank you. I would like to invite Dr. Haile Getahom, Director for Global Coordination and Partnership, to take this question.
Thank you very much. I understand the question refers to the network of researchers and centers. Yes, WHO is working with collaborating centers in certain different areas that address antimicrobial resistance, and we have also a system of collecting and strengthening the network. And also, as part of our broader One Health approach, in the future, we have also a plan to establish a partnership platform that will also bring the different academicians and the research centers and collaborators so that we can have shared vision and goal to tackle this crisis. Thank you.
Thank you. I would like now to invite Priti Patniak from Geneva Health Files to ask the next question. Priti, can you hear me?
Hear me?
Yes, very well. Go ahead, Priti.
Yes, thank you for taking my question. My question was on remdesivir. Can you please clarify whether remdesivir continues to be a part of the one of the arms of the Solidarity trial? And when will WHO share the trial data with other regulators? Thank you.
Okay, thank you. Priti, I wanted really to take the first questions about AMR to take the advantage of the presence of so many experts and guests. So I would like now to invite you to wait. We will take your question, but now I would like to invite Peter Kinney from Anatolu to ask the next question if it is about AMR.
No, my question is not about AMR.
Okay, so I think we will take the question about Remdesivir. Janet Diaz? Yeah. Preeti, can you just repeat your question? Preeti?
Can you hear me now?
Yes. Can you just repeat your question, please?
Yes, my question was whether and why Remdesivir will continue to be a part of the, one of the arms of the Solidarity trial, and when will WHO share trial data with other regulators? Because we understand that these are interim results, but are you going to share the whole data with other regulators, and at what point? Thank you.
Thank you. Dr. Diaz will take this question.
Thanks so much. So I'm going to just give a brief response on behalf of the colleagues that are actually in the research and development group that do the Solidarity trial. My role is mostly in writing the clinical guidelines. The Solidarity results are available in preprint, and those are publicly available, and that provided some of the largest evidence source for the guideline that we published in the recommendation we made today. That is currently under peer review in a journal, and from what I know, will be available shortly.
I could come in, Fadela.
Thank you.
Fadela, I could add.
Yes, please, Sumia, go ahead.
Yes, thank you, Preeti. So, as you know, the results of the Solidarity trial that were released on October 15th were interim results. So the trial is continuing with the Remdesivir arm till the sample size reached. We had an agreement with Gilead for a certain number of doses, and we will continue to enroll till we complete that. On sharing of the data, yes, absolutely. When we have these clinical trials and we work with different manufacturers, we have an agreement with them to share the database once the trial is completed and the data set is locked. So that will take a few more weeks because the trial is still ongoing. People are being randomized. But what will be available very soon is the peer-reviewed publication that should be out in the next couple of days. But it's almost the same as what had been released in the preprint. So most of the data is already out there. Thank you.
Can I just add to what Sumia said? That process at the end in terms of the raw data and the tables, that is a very careful process that each trial has to go through, and that is WHO is operating according to the best practices with all of the external oversight, the internal oversight, and the mechanisms to ensure that those final data sets are absolutely correct and reflect exactly what happened in the trial. So this is absolutely standard practice for what we're doing. The preprint, moving into what was being published imminently, the work that Janet and her team have led, which has been a very careful process at looking at our living therapeutic guidelines. Because in the end, all of this matters in the front line. Can frontline doctors and nurses get the information they need to make clinical decisions about the best use of drugs that will best help their patients? And this is what we're really aiming for. This isn't the battle of the scientific publications. It's not a battle of drugs. It's not a battle between drug companies. This is about getting the best possible information into the clinical teams who save lives on wards and giving them the best possible chance of helping people. The work that Janet, her team, and so many hundreds of clinicians around the world have done over the last number of weeks is to do a systematic review of all of the data available on therapeutics and ensuring that clinicians have access to the best possible synthesis of all of the data and all of the research collected. Sumia's team, the R&D team, Janet's team work in a fantastic collaboration of upstream science and discovery, trials, and downstream delivery of best practice. I've never seen a better example of how those worlds have engaged and interacted to the benefit of the people who need our help most.
Can I compliment Adela?
I think, Dr. Simao, do you want to add something? You have the floor.
Yes. very quickly. It's just on the communication to the national regulatory authorities. As you know, WHO had a condition pre-qualification based on data available in earlier trials earlier in the year. And right now, with the communication of the report and the guidelines coming out of WHO, the guidelines of recommendations on remdesivir, WHO has notified the producer, the manufacturers who have answered to the expression of interest for the pre-qualification of remdesivir and has suspended the pre-qualification that he had, the conditional pre-qualification that he had already issued in October until further review of further data. And at the time that we do this, all the national regulatory authorities are notified.
Thank you all. And I would like now to invite once again Laurent Siro from ATS, the Swiss news agency, to ask his question. Thank you for your patience, Laurent. Go ahead.
Thank you, Fadela. There was a British study released today that shows that most of the people infected seem to be immune now for at least 6 months before being threatened to be reinfected. Have you changed your observations on that question? Thank you.
I'll begin and pass to Maria. First of all, this is really good news to see that we're seeing sustained levels of immune response in humans so far out, and it's good news to see that, and we really commend the researchers for doing those longitudinal studies, and this is something that WHO is coordinating with many groups around the world, not just doing one study, but looking at the same group of people over a long period of time, because that's going to give us the best data on things like this. But we will obviously absorb this into our living systematic reviews on this. This is potentially significant news. It extends the period for which we know there is likely protection, and hopefully that period will extend further and further. We know there may be limits to that. It also gives us hopes as well on the vaccine side that if we start to see similar immune responses to the vaccine, we may hope for longer periods of protection. But Maria will have more details on how we're tracking that here.
Thanks, Mike, and thanks for the question. Yes, so this is very good news of research that's coming out from this group and also other groups that are following individuals over time. So what we are seeing, and you've heard us speak a lot about this, about really trying to better understand the body's reaction to infection in terms of the development of antibodies and neutralizing antibodies in particular. And what we're seeing now as the pandemic, we're reaching almost a year into this pandemic, some of those early cases are now being followed over many months. And these are studies that collect samples from those cases, those patients who have now recovered, but collect samples over every month or every few weeks or so. And we're now getting up to 4, 5, 6 months of actually tracking them and looking at the antibody responses. And this is very good news. It is promising and confirming what other studies are also finding as well. And so what these show is that the individual, and what we do know is that people who are infected with the SARS-CoV-2 virus will develop an antibody response within a few weeks, 1 to 3 weeks of infection. And now we're seeing that antibody response is lasting, and it's lasting for months. We still need to follow these individuals for a longer period of time so we can determine how long these antibodies last, but this is good news. In addition to studies that are following the same individual over time, WHO is working with more than 50 countries who are carrying out studies right now looking at the antibody responses in different types of populations, either the general population or frontline workers like health workers. We have an additional 50 countries that want to carry out one or more of these studies. And so this is building a body of evidence that is helping us to understand what proportion of the population has been exposed and infected, and what that is looking like over time. There are more than 300 studies that have published results so far, either looking at general population or leftover clinical samples, or have followed patients over time and looked at their antibody response. This is really incredible, and it's a tremendous body of research that is helping us look forward and helping us think to the future of what this may mean. Now, most of the studies that have been published have results from the spring of the general population studies, and what we're looking for are more studies that have results of populations sampled in the fall, in September, October, November. Many of these are currently underway, so we don't have the results of those yet. But what we're looking for is to see what does the antibody response look like in the population. So this is really wonderful, and we are grateful for all of our partners who are carrying these out. We are grateful for the labs that are developing serologic assays and trying every day to make those assays even stronger and even more accurate. And we are grateful for researchers who are working with us to share those results, because ultimately what we would like to do is be able to pool those results together to get global estimates, to get regional estimates, to help us think through and understand where this pandemic is going.
Thank you. I would like now to call on Peter Kinney from Anadolu, Turkish news agency, to ask his question. Thank you for your patience. Peter, you have the floor.
Thank you. My question is not on MRA or on COVID. It's actually to the DG. And I'd like to get some clarification from him, to just put the record straight. There's been a lot of allegations made about what's going on in Ethiopia and Tigray and his involvement there. Can he just straighten out, for the record, what the situation is? Thank you.
Dr. Tedros?
Yeah, thank you. Thank you, Peter. I think I have already issued a statement yesterday, and I believe that that's enough to clarify the issue. Thank you.
Thank you, DG. I would like now to invite John Zarakostas to ask the next question. John?
Yes, good afternoon. Can you hear me? Hello?
Yes, go ahead, please, John.
Yes. My question is to all the experts on the panel, and in particular to FAO and OIE as well. How much is the AMR problem being aggravated by overprescription of antibiotics by medical practitioners and by vets in poultry and cattle, for instance? And would mandatory labeling of what antibiotics are used help to reduce this in the animal side of things?
Thank you, John. I think we will start with Dr. Hanan Balkhi, and then we will give the floor to our guests.
Sure. Thank you very much. I think, this is a multi-tiered question, so thank you for this question. There is evidence that the misuse of antimicrobials has been aggravated definitely by COVID, which was not a surprise to us because the misuse of antibiotics in any viral infection has already been a very long-term issue that we've been struggling with, and we've been trying to advocate for not using antimicrobials for viral illness, specifically with respiratory diseases where the majority of infections are caused by viruses. We have established in the updated guidelines of May 2020 for the COVID treatment on the scenarios where antimicrobials could be used. So if you can please refer to that as well. And it discourages the use of antimicrobials as empiric therapy in community infections and people who require to stay home. And in those who are in the hospital setting, for the healthcare providers to definitely look into de-escalation or downgrading therapy and discontinuing it when a bacterial infection is no longer identified in that specific patient. The other thing that's has been very relevant in the literature is looking, and several studies have already came out, showing that looking into admitted COVID patients, not more than 10 to 12, maximum 15% of them would end up with a super bacterial infection or a secondary bacterial infection, yet over 70% of them are receiving antimicrobial agents. Again, not a very unique scenario for misuse of antibiotics, and that is why the AMR division has been working really hard on establishing and providing technical assistance for establishing antimicrobial stewardship programs in the healthcare settings. So there's a lot to say about that, but I'd like to hand it over back to Fadila for the rest.
Thank you so much, Dr. Balkhi. I would like now to invite Dr. Matthew Stone. He's an expert with OIE who wanted to respond to John Zarakostas. Dr. Stone, you have the floor.
Thank you very much. It's actually a very complex question. because the technical issues associated with attribution of the antimicrobial resistance burden globally to a use and overuse, let's be clear, in human health, animal health, plant health, and the potential outflow from usage in each of those sectors into the environment is a very technically complex issue. So we're not able to, at this stage, attribute the burden of disease to any particular sector. But as Dr. Balkhi has said, there is a huge effort going on, a combined effort, a One Health effort across the tripartite agencies and with our international partners to deliver the message of prudent and responsible use of antimicrobials, to account for our usage, to ensure that there are clear clinical treatment guidelines and a good understanding of the hierarchy of molecules of usage, so that the most important microbials are preserved for the most important uses. Let me also note that in the animal health sector, the OIE has a long-standing program. We're now into our 5th year of data collection to work with our member countries to understand their usage patterns of antimicrobials in animals, across terrestrial animals and aquatic animals, to understand what molecules they're using and what diseases they're treating in terms of those molecules. We're producing an annual report, and this accounting mechanism, this transparency associated with usage, is allowing countries to track their own usage and hopefully drive that usage down, but most importantly, drive it towards prudent and responsible use. Over.
Thank you so much. I would like now to invite Simon Ateba to ask the next question. Simon, can you hear me?
I can hear you.
Go ahead, please.
Thank you for taking my question. This is Simon Ateba from Today News Africa in Washington, D.C. And my question is to Dr. Tedros. Joe Biden is now the president-elect here in the U.S. after his election victory against President Trump on November 3rd presidential election. Already has promised to join the WHO on day one, and when he's sworn in on January 20th, 2021. What's your message to the incoming American president? And beyond the COVID-19 crisis, what other type of partnership would you like to have with the U.S. going forward? Thank you.
Yeah, thank you. Thank you so much for that question. It's very important. I think communicating to leaders through media wouldn't help, but we're in touch. Thank you so much. And we have already sent our messages. Thank you.
Thank you all. I think we have reached 1 hour since we started our press conference. If there is any other comment from our guests or expert from WHO, I would like to hand over to Dr. Tedros for his final words.
Thank you. Thank you so much. And once again, I would like to thank Prime Minister Mottley and Prime Minister Sheikh Hasina, and also my two colleagues, Dongyu Chu and also Monique Elliott. And I would like to thank all those who have joined today and look forward to working closely through the global leadership now. We have the most committed leaders in the two prime ministers, and look forward to work closely to make a difference in AMR and, of course, One Health. And I would like to also thank to all the media who have joined today. And I would like to thank to all colleagues who have been working on, building this global leadership from OIE, from FAO, and also from my own colleagues from WHO, Hanan and Getaun. It's it's really well done. And thank you so much, and see you in our upcoming presser. Thank you.
Chief, can I just add on the fact that it is World Children's Day, just to shout out to our sister agency UNICEF and all of those agencies and NGOs and others and frontline workers who work with children around the world, and especially to those children out there. We all have them. I know how tough it is for you kids to keep explaining the world to us, to try and make it better. And as JFK said, I think we should listen to this as adults, that children are the living messengers we send to a time we will not see. And I think if we think about our children in that way, we will see that they are the true value of our society and the true resource that we send to the future. So, as you said in your speech, DG, but from the staff at WHO as well, I think we stand today with those who stand for children.
Yeah, thank you for reminding me that, Mike. I would be happy to join Mike in this. And as you know, today is World Children's Day. And as our colleagues at UNICEF say, it's a day to reimagine a better future for every child. And we would like to send greetings to Henrietta Fore and all our UNICEF colleagues. Although children are less at risk from severe COVID disease, children have suffered from the pandemic in many ways. And our response to the pandemic and the way we recover from it will shape the world our children grow up in. That makes it even more important to fight the pandemic with every tool at our disposal to save lives now and give our children a better future. I thank you.
Thank you, DG. Just reminding journalists that they will be receiving the DG opening remark and the audio file just after this press conference. The transcript will be available as of tomorrow on the WHO website. Thanks to journalists who are following us regularly, and special thanks to our interpreters team. If you have any follow-up question to WHO or our sister agencies, please don't hesitate to contact the media team at WHO. And have a nice weekend.